The Albuquerque Bernalillo County Government Commission meeting will come to order. Commissioner O'Malley will be joining us via telephone, and Commissioner Maggie Hart-Stebbins and Councilor Harris are excused this evening. We will now proceed with the moment of silence and the Pledge of Allegiance led by Commissioner Smith. Next, I'd actually like to welcome Commissioner Smith to, obviously, to the commission and to the ABCGC committee. Welcome aboard. Would you like to say a few words?
Thank you. I'm not real sure what I would like to say to the group. This is brand new to me. I'm really excited about joining your group, though. It's been a fantastic experience with the county so far, and I'm looking forward to working with you guys as well. Thank you.
Great. Welcome aboard. So next item, I actually, as the committee, I just want to thank Commissioner Quesada for chairing the ABCGC in 2017. Thank you for your service. And here's you're official now.
Thank you so much. I appreciate it.
Okay, well, with that, we'll move on to approval of the minutes. Are there any changes to the March 22nd, 2018 meeting minutes? Hearing no changes, I make a motion to approve.
Second.
There's a motion and a second to approve. All those in favor say yes.
Yes.
Opposed, no. Motion passes. Next item we have is public comment. There will be a two-minute time limit. The light on the podium will turn green for the first minute and a half, and then a bell will ring and turn yellow, indicating you have 30 seconds remaining to wrap up your comments. At 2 minutes, the light will turn red and ring to indicate your time is up. Do we have any? I said all that. We don't have nobody. So oh, yes, we do. We have one gentleman here.
This isn't so much a public comment, just as a question. I was trying to get information from the Office of City Council regarding the Behavioral Health Initiative meetings, associated meetings, times and locations, as well as any contact information regarding that, and had a bit of trouble doing so. And finally, when I did get a response, I was instructed to come here. I'm not the person that's supposed to be here, but I'm just trying to get information concerning that for the organization I work for.
You are actually in the right place.
Okay.
So I think if you want to meet up with Katrina Holtram, she
Okay.
actually can provide you further information.
Thank you.
So thank you. Thank you for being here. Took a lot of
Madam
effort.
Chair, I
It must
think
be
Mr.
important.
Murphy had,
Oh, I'm sorry.
you're good, okay.
Councilor Benton.
Just in response to that of the communications, I know that one of our agenda items, or is it our only agenda item tonight, has to do with communications. And we try at the City Council, we try to maintain links and so forth to the Behavioral Health Initiative, and I know that there's, just from experience, that there's room for improvement in our communications always as public officials. So sorry the gentleman had a problem getting his information.
Thank you for those comments, Counselor. So next item we have is, under new business, item A, approve revisions to the ABCGC rules of procedure allowing members to participate telephonically. This would be Commissioner Quesada. I know this was brought up by you. I don't know if you want to talk about it.
Well, you know, I mean, we from time, thank you, Madam Chair. From time to time, things come up. And I just don't think that we could stop doing the business of the city and the county together if we don't have a quorum. And I understand that, you know, this particular committee, we have problems getting a quorum. And so I think we push the business and we keep pushing it forward, and we're not really getting the work done. And I think that if we could change that procedure, that would, that would help us always at least have a quorum, I think. And case in point today, we have, Commissioner O'Malley on the phone, which helps the county to be able to participate as a voting body. And so I would like to, make sure that both sides, county and the city, would have those same, opportunities. So that's basically why I brought it.
Madam Chair?
Counselor Sanchez, I was
Oh,
going to call
thank-
you Commissioner too.
Well, you could. I was a county commissioner at one time. I support the initiative. I think it's important that we do have a quorum. And we had this happen Monday night with Counselor Benton. And telephonically, it worked out very well. He was, present on important initiatives, especially the budget. And how the city has, what we have in place right now is the city can, basically the individual that's not here can telephonically call in with the council rules, and it's basically the president that gives its blessing, but maybe the chairman of the ABCGC can do the same thing, and we don't have a policy currently in place. But I definitely support the concept and the initiative.
Counselor Benton.
Madam Chair, thank you, Commissioner Quesada, because, clearly, as you say, the people's business must continue. I personally had a difficult experience technologically with the Monday night meeting. So this is the first time I've ever done this, of calling in, ever in 13 years. So it was odd. And I'm not the most technologically adept either. But I think we do need to, we probably need to talk between the city and the county on the cost of having a more predictable system. So I think I was actually heard mumbling a curse, but it was during the, that came out over the air. But that happened to be about dealing with the system that we were dealing with. It wasn't about the subject at hand, although I said something about that too when it came out. But that was one of those things where someone said, I didn't mean to say it, but I meant what I said. Yeah, so anyway, but I think it's ironic that this week you bring this up, and I just had a strange interaction with the system, such as it is, which is not really much of a system. So I think we need to look into, I don't think it would be a fortune to get this fixed out where somebody can call in and everyone could hear it. For instance, at our meeting, at our council meeting Monday night, I could hear everywhere from the chair to the right, but I could not hear, very poorly hear the people on this side of the dais. Same thing with staff. I could not hear, Stephanie, for instance. So, we want to be in touch, but we need to really be in touch and not be hampered in any way if we're going to do this. So that's my point. Thank you.
Any other questions, comments? No?
I'd like to follow up with saying that now that we're pushing this forward, now it's a more feasible time to look at the, what technology's out there and to improve it. I think before they never really looked at it because, nobody was doing it. But now that we're changing that procedure, I think we can look at working together, because that's what we're together here doing anyway. And how do we come together and put in a better system?
Thank you, Commissioner. So I know we have, this is an item for approval, but I guess what I would direct the staff is to kind of look into purchasing a system that would work for both the city and the county. I think we can pay for it together or whatever the case may be. And then I'm not real sure if we need to outline some policies or any procedures as part of this, but I think we can maybe just go ahead and approve that we are going to go this direction, and then we'll come back with some additional information. So with that, I would make a motion to approve item A.
Second.
There's a motion and a second. All those in favor say yes.
Yes.
Opposed, no. Motion passes. Next item under old business, we have item A. Is that correct? Okay. Staff update on APS, board members on ABCGC. This is myself and Commissioner Quesada, and I'll let Commissioner Quesada get started.
Thank you, Madam Chair. This is something that, as you all know, I served 4 years on the Board of Education, And there's been times, many times that either the city or the county, and I think, you know, we're going to be doing bigger things. I'm hopeful about doing bigger things with this body as we, you know, look at how the city grows, how we look at infrastructure, how we look at behavioral health money, and there's so many different other aspects that what you don't realize, that everything and every decision that we make moving forward affects APS in a way. And we really felt that they should be sitting at the table to have these discussions with us as we move forward, whether it's development or any of these things. We have, and I would like to defer also to, we have David Piercy, who I believe is the president of the Board of Education at this point, and Mr. Cazito, who also works for APS, and I was wondering if they could come up and say a few words on why they also feel that this is important, because I think they can elaborate on what's more specific than what I can do for you right now.
I have them to call them up in just a second. I don't know
Okay.
if there's any other questions from any of the counselors or commissioners. No, from the administration. So if you'd like to come up, Mr. Cazito, with Jen J, and Mr. Piercy, who is the president of APS right now.
Well, thank you very much for considering us for this, membership. I think, again, if we can bring something to the table, I think that's great, because I think, in fact, APS does have a large impact on the county, large impact on the city. But again, the city and the county have a large impact on us as a board member. Casado is always a board member to me. So, I think Casado has a lot of specifics about how that might work. I know we're part of MERCOG, and a lot of you are part of MERCOG as well. And of course, that's a large infrastructure as well. So I think trying to get a lot of this collaboration together is really an important thing to do. And we're certainly willing to work with you guys. In other words, that's the point. So if that's going to be of value to you, then I'm certainly in favor of doing that. So I'm going to let Casito talk a little bit about some of the things that he thinks might be specific.
Thank you very much, commissioners and city councilors. Just briefly, I think our impact, our main thrust on this would be concurrency. And in talking about concurrency, in that when we collaborate, APS covers 1,200 square miles. So it covers the whole city, the whole county, and even part of Sandoval County. Everything that the city does, everything that the county does, and everything that APS does is paid for by the same tax base. So if we can leverage whatever impacts and efforts that we carry through, so that not only are we leveraging the most bang for the buck for our taxpayers, whether it's sharing and location of health centers, whether it's of facilities, whether it's collaborating on transportation. For example, APS right now has the largest transit operation in the whole state. 400 to 500 buses, 60,000 riders, over 50,000 miles a week. And those 60,000 riders is every day. So given what the city is doing, given what the county is doing, and since we are impacting the same tax base, there's a lot of collaboration and there's a lot of things that we can do together where that tax dollar can go really a long way and help everybody in this county of approaching 1 million people. We deal with 84,000 kids, 200,000 households, and that's just a subset of what everybody does over here. So when we work concurrently, we'll cut down on waste, and we will coordinate whatever efforts, whether it's in health, transportation, public safety, that we are trying to do. So thank you.
Madam Chair.
Commissioner Quesada, followed by,
Thank you, Madam Chair. Mr. Cazito, I mean, I think something else that's very important is when we're talking about construction and building, what are the statistics that for APS and how does that affect what we do when we're making policies and procedures on that?
So on construction, unfortunately, with the downturn in the economy, our non-commercial construction really went down over the past 5 years. But the last time we counted and worked with both the city and the county, our commercial construction, which is schools, new schools, rebuilding of old schools, and refurbishing of our facilities, of which we have 15 million square feet of built environment over the whole county area. We were about 68 to 74% of all commercial construction building permits in terms of dollars were coming from APS. This is the same tax base. APS gets 90% of its capital money from this tax base. It doesn't come from Santa Fe. Yes, Santa Fe does supplement some of it, but the bulk of it comes from this community. So if we can be concurrent and leverage what everybody else is doing to maximize what we are doing in the built environment, maybe plan, when we are designing schools, of which a typical high school is 500,000 square feet, a typical middle school is 250,000 square feet. If in a way where not only can we locate, say, health centers, not only can we working together on public spaces, we can design it such that concurrently we can then bring in operational dollars from all agencies, and we don't have to duplicate facilities, especially in areas of the county, both Sandoval and Bernalillo, that have a dearth of public facilities. That's lots parts of the west side, the East Mountains, because taxpayers also live there. And these are not new areas. Some of these areas on the west side and in the East Mountains are some of the oldest communities in this area. And some of these taxpayers have been paying taxes for generations. So the best way to leverage and give them services is not by taxing people more, but being concurrent and collaborating and being efficient on how we use what we already have.
Thank you, Madam Chairman. School Board President, Dr. Piercy, thank you for being here. Mr. Casito, you and I have worked well together on many of the West Side initiatives, and I think you're right on target. We need to start leveraging our resources. When we built Community Stadium, that was a $40 million facility. We built the Field of Dreams, the baseball park on Albuquerque's west side. That was a $21 million facility. I mean, we can look at showing, the parking structures, a lot of different things. And I think that APS and a couple of school board members should have a seat at this table. Just Monday night at the Albuquerque City Council meeting during the one-year budget objectives, one of the things that was brought up were the school crossing guards. And basically what the city of Albuquerque and their objectives wanted to do is, provide the support for the crossing guards, but give the money to APS basically to oversee the crossing guards. I think that APS should definitely have a seat at this table, especially when we're talking about our young kids, because there are so many initiatives and issues that we can work on together that I think will really benefit the taxpayers of this community. So I think it's a great idea, Councilor Pena, Councilor Quesada, that APS is involved with us in making some really critical and important conditions that really impact our community and our young children.
Yeah, and I think too, in the behavioral health issues, which is a big issue to us, and it's a big issue, I know, to Commissioner Quesada, but some of the underserved areas really need some of these facilities. We've got one, for example, at Manzano, and I guarantee you it helps the kids stay in school. It helps the parents not having to come get their kids and get out of work, and those kind of things are really, really important. So if we can actually leverage some of that in some of our particular underserved areas, that's really important, I think, to our families. And so we'd really love to work on that too. And I think in the behavioral health, which you guys deal a lot with, of course, that's one of the areas that we certainly could collaborate on. So.
Thank you. Any other questions? Counselor Benton.
Board President Piercy and Cito, we know each other from a long time. We've had our ups and downs. I think I strongly support the presence of APS on this board. The transportation thing, of course, you probably guessed that I was going to bring that up. But I mean, it is a quandary. I mean, transportation is a quandary anyway, you know, to get from the east side to the west side. But beyond that, it's important when we look at especially urban older schools and then the APS charter schools too. Because, you know, some of these charter schools grew out of a place where there might not have been that anticipation of what was going to happen there in terms of traffic. Same thing with urban schools. So you know, I know you guys get this, and we've had our discussions, like I say, but that kind of line of communication where we're all here in front of the TV cameras, you know, and the public can see what we're talking about, and they can decide for themselves. This really is a valuable asset. And so I appreciate your interest in doing it, and thank you, Commissioner, for bringing this forward, and Councilor Pena.
Okay, well, with that I agree. I'm going to turn it over real quickly before, just kind of make some closing comments to Nicole so that she can give us an update and kind of a path forward, because we don't have this as an approval item this evening. It's really trying to figure out how we make this, get this collaboration and partnership to work. So, Nicole.
Thank you, Madam Chair. So I did do some research after our last meeting, and what I found is that City Council passed a Resolution 10-39, which was enacted in March 2010. The bill supported the reestablishment of the ABCGC and also approved the third revised intergovernmental agreement for the ABCGC. The third revised IGA, which was attached to the bill, specifies that membership shall be comprised of 4 county commissioners and 4 city councilors and the mayor. The ABCGC rules of procedure also, also state in Section 9 under voting that passage of all non-procedural motions, which are items on the agenda for action, shall be by a 2/3 majority vote of ABCGC membership consisting of at least 3 votes in the affirmative cast by members representing the county and 3 votes in the affirmative cast by members representing the city. There was no other information related to membership. So therefore, if the APS members were to be voting members, the ABCGC rules of procedure would need to be changed to accommodate for that. Also, a new IGA would have to be signed, and what I provided you is a draft of the potential changes. And the City Council would need to vote on an amendment to R39 to introduce the new IGA.
Thank you. Ms. Taylor, does anyone have any questions for her? No? Okay, so it sounds like we have a game plan moving forward. So as for me, I just want to say that, you know, the ABCGC, I know we've gotten, the focus has really been on behavioral health since the behavioral health tax is passed, but it's really a collaboration between the city and the county and how we address a whole array of issues. And you know, I'm just really proud to say that, you know, working with Commissioner Quesada in terms of my district, it's been, the partnership and the collaboration has been so important. We've been moving a lot of things forward. I know there's been some, you know, some hesitation. It's difficult, you know, when 2 different local units of government are working together and trying to navigate through that system. But at the end of the day, it makes for a better community, and we're hoping, you know, the discussion that we were talking about when we said we should actually invite APS to the table, because it is, you know, oftentimes even at council or other places, you know, we have ideas about what APS maybe is doing or not doing, and when you're at the table to be able to provide that information that we have a gap in, I think it's important. It's important to bring the city together. You know, Mayor Keller talks about it being one city. It is one city, and in order for us to do exactly what you were saying, Mr. Wajenje, is really looking at how we best use taxpayer dollars and being good stewards of taxpayer dollars is very important. I know for my district alone, you know, the school overcrowding, when I was advocating back in the day, you know, we've had so much overcrowding in the schools, and it really took a community to come together to make sure that we got those schools built on the west side, and now we're faced with similar problems. So I think the collaboration is going to be important, again, for a whole array of reasons. So with that, I don't know if you want to close, Commissioner?
Yeah, thank you, Madam Chair. And, you know, one thing that we want to make sure that on transparency and for that, that, you know, if APS does submit an RFP, say, for the behavioral health kind of stuff, I think that it's important that we discuss now as we move forward that, I mean, it would be great that they have input, but I think that if it was something that we were going to directly fund through the behavioral health money, that they would have to like recuse themselves from an actual vote on that. Could we look at that and how that would work? Because I think we just don't want to get into trouble when we're voting on money that we're going to actually be putting into APS and how that's going to work. I just want to make sure that when we do add them to this board, that it functions in a proper way and that they know what their limitations are or what they can really do to participate. I think, again, the reason why I would love to have them here on this board is it's a bigger picture than just the behavioral health, but I wouldn't want them, because of their presence on the board, not be able to, you know, do the RFP and apply. So I just wanted to throw that out in the spirit of transparency, that we would have to figure out certain tweaks to how that would work, and we'd probably need our legal department to kind of look at that and see how that would really affect them on the board, because, you know, again, it's going to be bigger than just behavioral health, but we don't want them to get caught in that particular weed. That's all. Thank you.
Councilor Bett.
Yeah, I think that's an important point, and I'm sure staff will figure out what the hurdles are legally and so forth in terms of intergovernmental agreements. But I think if the intent is, for the short term, is just to get APS on the board, then that's relatively simple. But the behavioral health initiative is sort of different in that we recognize the value of our education system in that field, and certainly there's a lot to be gained of having them here at the table discussing that as well. But the question would be, are we changing the makeup and the composition of this board, but also are we trying to tackle that whole thing too? Because the arrangement that was made for the behavioral health initiative was not simple. It was not easy. There was a lot of kind of jockeying around about what we ought to be doing and how we make up the board. So, you know, it could raise more questions. So there's kind of a two-tiered issue there, and it's absolutely, I'm not in any way suggesting that we wouldn't value the expertise of APS on our discussion of the behavioral health, but that structurally it would be a bigger hurdle to jump over.
Commissioner Smith.
Thank you, Madam Chair, and good to see you guys. I've worked with Dr. Piercy and Casito numerous times in the legislature. And I like the idea of you guys being on this board. I'm assuming that we're making them full voting members on the board. Is that the implication?
I think that's the intention. So we're not going to actually vote on this evening. The staff's going to move forward and kind of come up with our game plan moving forward.
Thank you, Madam Chair. I just might point out under operating procedures on the second page, if they are members of the board, then that may change the quorum requirements as well. In paragraph 5, it says a quorum will be defined as 2 members from the county and 3 from the city. We may have to adjust that as well if we have more board members.
Absolutely. And the other challenge that we're going to have is that actually right now we have 9 voting members, so it's odd. And if we added 1 APS member, it would be 10. So I don't know that we necessarily want an even number, so we may have to add 2.
It has 2 in there.
Okay. Okay. So with that, well, thank you guys, you gentlemen, for being here. I really appreciate it, and more to come. Thank you. Thank you. So next item under old business is item B, continuing behavioral health initiative action discussion, status update, and direction going forward. Councillor Benton and Katrina Holtram will give an update. Hey, Katrina.
Hello. Thank you. Madam Chair, Commissioner Benton, do you want to go first? No, I'm kidding. I'm kidding.
Let's, Madam Chair, just quickly, let's make clear, this is something I asked to be on the agenda, and I never purport to be the presenter, so thank you.
And if I could stop you, Katrina, so I appreciate that. So maybe, moving forward, we'll kind of, have that question asked if you intend to present. But, so the next items, do we want to go through each one of them individually, or would you like me to read each of the items that you're going to report on so that you just do it as one whole report?
Madam Chair, I can do this as one whole report, and we do have a discussion item, but I can do it as one full report and then ask for a vote.
Okay, well,
That's okay?
let me just do this. So under the continuing behavioral health initiative action discussion, we're going to be discussing the status update and direction going forward, opportunities for subcommittees to address the commission, and then finally, we'll have an approval bridging the behavioral health proposal, and then we'll end it with the ABC behavioral health initiative overview and guidelines, phase 2 discussion.
Thank you. So, Madam Chair, members of the commission, I guess, we've had a lot of activity going on. The Resource Reentry Center was another big activity that we had over the week. I appreciate some of the commission wearing their behavioral health pins again, because it is Behavioral Health Month. Some of the activities that we've been really working on include monitoring the effectiveness of our mobile crisis teams and that implementation. We are hearing a lot of great things in the community, that we're very effective in diversion, and I believe that we have approximately to date over 100 diversions from the emergency room or jail just from the mobile crisis team intervention from the city and the county side. In addition to that, we have community engagement teams that are also running together. These are pre- and post-crisis teams that will help not only intervene with mobile crisis teams, but also out in the community. So if someone's not in crisis yet, they need that service, they're going to have peers engage them in a warm handoff. That they've also been linking to do follow-up work after mobile crisis teams. And I know, Councilman Sanchez, you've been very interested in our design and system of our crisis system in general. We know that mobile crisis teams are a piece to that, but we also are working quickly and diligently with the state of New Mexico as well as with the University Hospital in order to figure out the design of a crisis triage center. Some of the things that have been holding us up a bit are the regulations that the Department of Health had to come out with to repromulgate rules on crisis triage centers. Those are out for comment now, and actually we go out to talk about that to Santa Fe next week in public forum to comment on those. So we've done public comment or written comments, and then we'll be there as well. But looking at the crisis continuum, it's not just one building. If you think about healthcare, it's not just a hospital. It's clinics for prevention and intervention, and it's also urgent cares. And so the other thing that we have been working on, and the Human Services Department did come up with a fee schedule, is working on less than 24-hour clinics. So these are your urgent cares. But we want to implement that for mental health as well. So we don't want to just deal with the physical body, but the mental health piece as well. We have been struggling. We've been working with the University of New Mexico Hospital. One of their best kept secrets is that they have an urgent care downtown at their location, but it closed at 3 o'clock. We pushed them. Now they're able to open until 6. But the reality is getting a provider in there to open until 8 o'clock is a challenge. So some of the proposals that you will be seeing in the near future are things like providing sign-on bonuses for these types of providers and working with our federally qualified healthcare centers, such as First Choice, because we know they get enhanced reimbursement, to actually open and run these clinics in key areas where we're getting the 911 data that show that there's a lot of calls and responses in these areas. So we're actively working with First Choice on what it looks like to open an urgent care, not only in the South Valley, but I know that you're going to love this, Commissioner Smith, but also in Edgewood. So we're working on those pieces of that continuum. So by the time you have your shiny building, it looks like we have a crisis continuum in place. So those are the things that we're working on. We should have some probably pretty quick developments, I think, by July to report out to you all on. And we have been working, of course, with the city of Albuquerque every step of the way to make sure that we have their involvement as well. In terms of other things that we're working on, I know that we do have a chair here, Kathy Finch, who may or may not want to report out on some of the activities as we go into our next item.
Good evening, Chair, Commissioners, Councilors. We have come to a change in program of the subcommittees. The money is pretty well allocated, and we sat up and we said, no more money? What are we going to do now? We really like having our finger on the pulse of all of this. And it is happening where there's a new look at our role in this, and we are remaining in a role with this, which excites us. We are going to be looking at what has been happening and starting to work on evaluation and modifications. So we remain in the loop and continue to have our creative thoughts put out there, discussed, and hopefully can fine-tune some of these endeavors, maybe redirect money, maybe redirect activities. I may be overstepping my bounds, but we're excited about this. Community Supports is looking at the possibility of offering student loan forgiveness to providers who can work full-time as an incentive to come to New Mexico or stay in New Mexico and potentially get enough hooks into the community to want to stay longer. So that's where we're at now.
So, Madam Chair, I guess we can get the discussion item off in terms of the phase 2. She just explained it. But really, to just step on that so that, or just to add to that as we go through this, is, yeah, we are looking at a change, and we are slowing down in terms of the proposals themselves because we have so much money tied up. But that's just where the work begins. So with the University of New Mexico Institute for Social Research, they're beginning their evaluation process. Plus, we've hired some staff that can do contract management and compliance. And we are working with our consultants on a number of items, including what phase 2 really looks like as we start looking at implementation, getting reports out from our providers, monitoring for effectiveness, and then affecting change. And we're also working with our consultants on you know, how all of this is really going to take place. One of the things that they had in front of them was a challenge is to actually recommend a permanent governance structure here. And so we're working through those things. We're just going to slow down, probably go to quarterly meetings. They'll meet more if necessary, if they have to work on proposals, but otherwise meet to quarterly. Our steering committee will probably right now continue to meet monthly, but then move to bi-monthly and potentially quarterly at that point too. Our small working groups will probably go to bi-monthly meetings so that we can continue to monitor and develop our activities. So that's basically that structure here that we'll be able to report out and show you what our findings are at this point. We are also working on one-time projects, so we're not looking at renewing of funding, but sometimes one-time investment dollars to see how they work, because we're sitting on a little bit of money that we can expend as we move towards the crisis triage center itself. But with that, Madam Chair, Unless there's any questions, I would just move on to approval.
Any questions? Counselor Benton.
I'm just going to, again, raise the technology question. I think, I applaud the approach, and we need to do it. But I'm just going to say, just speak an anecdote. So I don't know whether it was the same gentleman who spoke earlier, but we did have, our office had a question about the initiative and about how to find out about it and so forth. And just in looking at the website, there's a lot of room for improvement. I'm just going to say that, no knock on anybody. But so I do think that this is very well warranted. And both the city and the county have IT departments, so I really think, having those real interlocked on this and make sure we produce the best possible product in terms of what our website and how all the interactivity works is extremely important. So, and I know that these are on your radar screens, but that was just a recent experience. We had difficulty really helping out somebody with information.
Thank you. Madam Chair, that's a great segue into this actual proposal. The proposal tonight that's before you that we're seeking approval on is called Bridging Behavioral Health. And it's really bridging behavioral health and health into our communities. So we have an obligation not to just look at behavioral health as a piece to helping our community. We have an obligation, and the subcommittees understand this, that we have an obligation to look at all the social determinants of health, because that is what's going to improve our community overall. A piece of that is behavioral health. And so what we want to be able to do is do a media campaign that really enmeshes ourselves in understanding not only what we're doing in terms of the behavioral health initiative between the city and the county and the university and all of our partners and subcommittees, but it's also looking at those connections and how we get the word out and how people understand how to get healthy food, as well as great bike trails, as well as dealing with their mental health issues. And those are sort of the things that we want to be able to promote, having that primary focus on behavioral health as a whole. Part of this proposal, Councilor Benton, is actually a website and a web design. And that's exactly what we want to do. We do not believe that we will be contracting out most of this money. Our goal is to keep this money in-house so that we can, get the word out. We've got a lot of media and resources between the city and the county. We work together well in terms of our media. And so utilizing that and leveraging that and actually having some money to do some fun things to get our word out there, I think is extremely important. So that's exactly what this proposal is, and it's seeking approval for $200,000 to fund the Bridging Behavioral Health proposal. This request is coming from the Prevention Committee and then hence from the Steering Committee.
Councilor Sanchez.
Thank you, Madam Chairman. I want to personally say thank you to Mrs. Finch and also the members of the committees that have brought some really great initiatives forward to this board. I think your work was very well done over this time frame, and it was a real commitment and time commitment on your behalf and all the different members. But what you've brought to us, I think, is very creative. I think it's really going to speak volumes as we start to implement a lot of these different programs, which we've already started to do. And I'm very pleased to see, Katrina, and to hear that we are working towards the Crisis Resource Triage Center. And I like the idea also of putting different components in our communities and not just at one location. I think that's going to be critical for the success of this program. What I saw in Tucson and in Phoenix I was very impressed with, but I like the idea of having multiple areas where people can go and get the treatment that they need. But I think this is going to be a real positive initiative for our community, and hopefully and that's why I'm serving on this board, because this was such an important issue for myself and for many of the people in our community that are wanting this kind of venue, but I'm glad to see that we're moving in the right direction, and thank you for all your work.
Thank you. Thank you.
Thank you, Councilor Sanchez. With no other questions, we will go ahead and I will approve Bridging the Behavioral Health proposal. There's a motion and a second for approval. All those in favor say yes?
Yes.
Yes.
Oh, I'm sorry, Commissioner, I forgot you were on the phone. Did you want to add anything?
No, thank you.
Okay. I said all those in favor say yes, so opposed, no? Motion passes.
Thank you.
Thank you, Katrina.
Thank you.
Any other business?
Commissioner. Thanks, bye.
So then following is the next meeting is June 28th, 2018 at 5 PM in these chambers. There being no further business, this meeting is adjourned. I hope everyone has a safe and happy holiday weekend.